What a privilege it is for me to kick off this review of the first decade of the 21st century with respect to healthy people. And let me start by thanking you and all of our colleagues assembled here, our leaders in the Office of Disease Prevention and Health Promotion, Dr. Ed Sondick, the Director of the National Center for Health Statistics, and all of our wonderful colleagues at CDC. And this is a presentation that reflects the work of thousands of people across the country over many, many years. So it's a tremendous honor for me to help kick off this review today. So let's move on to the second slide. You all know that healthy people is part of our public health history, and it's a comprehensive set of national objectives that gets monitored, updated, and reviewed every 10 years. Having a framework like this is absolutely vital to drive action, to see where we are as a country with respect to public health outcomes and where we need to go. It helps us set priorities and guide actions for the future, and it has developed its own history and legacy that we're very, very proud of, and this announcement today furthers that legacy in our view. On the third slide, you'll see the history of this tremendous effort. It started with my predecessor, mentor, and friend, Dr. Julius Richmond, in 1979. And so over the last 30 years, we've had multiple iterations of Healthy People. Today, we are updating Healthy People 2010 that was launched a decade ago. And so if you look at this from the broadest possible lens, you see progress in many areas for the country, and then identification of new areas where we need to go as a society to become even healthier than before. On the fourth slide, you see some key features of Healthy People and what it's intended to do. It addresses issues of prominence with respect to public health. It's data-driven. It sets hard targets and objectives. We measure progress over time. We use that information to drive action, not just at the federal level, but particularly and very importantly on the state and local level, and you're going to be hearing from a key state leader about that in just a second. And it's absolutely vital with respect to building collaboration. So it's prevention-oriented, action-oriented, based on excellent science and evidence and data, but most important of all, appeals to everybody in this heterogeneous country. Next slide is one of my favorite slides, even though it's very, very simple. On the left, we see that we have many non-aligned random acts of innovation, and there are so many on this call and throughout the country who are very dedicated to improving public health, doing it in their own way, setting their own goals and targets. But if we can put all those efforts under a broad Healthy People umbrella, as you see on the right, we can really maximize the efforts of all these groups going forward and really unify our efforts as one country. So we call Healthy People a roadmap and a compass for the country, and we're very proud to call it that. And unveiling this particular report at this particular time is very critical because we have tremendous activity throughout the department in unveiling a whole array of new national public health plans in HIV, in tobacco, in flu vaccination. Just yesterday we unveiled one in environmental justice. This is being done now in the context of the Affordable Care Act, which has tremendous emphasis on prevention and public health, a new prevention fund, a new prevention strategy. And so using the Healthy People Foundation is absolutely critical in a moment like this to continue to align all these good efforts. The sixth slide shows the key players, and I've mentioned many of them, our Office of Disease Prevention and Health Promotion, federal agencies throughout HHS, and in fact throughout government, and we're very proud of the broad health and all policies approach that's being put forward through such a broad federal collaboration. Dr. Sondick and others at the National Center for Health Statistics have been absolutely invaluable, and Dr. Sondick's personal commitment to this is extraordinary. I just want to thank him so many times because we would not be here without his leadership. And I can say as a former state health commissioner that we really want state and local health departments to also use this information to make change locally, and we're eager to hear from the health director from Connecticut in just a second. The next slide just shows how this process has evolved over the last number of years. We now have 4 overarching goals, as you can see there, for 2020, but for 2010 that we're reviewing today, we're still focusing on the 2, increasing quality and years of healthy life and eliminating health disparities. There's some 28 topic areas and over 900 objectives that we set over a decade ago. The next slide, slide 8, stresses again that this is a federally led but stakeholder-driven process, so we at HHS and Office of Disease Prevention and Health Promotion are pleased and honored to coordinate this, but the real work goes through the Federal Interagency Work Group, the state and local governments. There's so many people who arrived and spoke at regional and state meetings around the country, people from the community whose voices we want to hear, and then ultimately individuals, families across the country who care about their health and want to improve the health of others. On slide 9, we show how people can use healthy people moving forward, not just for data, but also for a broad perspective on how we're doing as a country. We want to use this information for goal setting and agenda building. You can obviously use it for education, setting benchmarks to compare progress around the country. And the more we have non-traditional partners, particularly promoting this health and all policies approach, the better off we're going to be. So slide 10 reminds you of those two overarching goals, and we'll be saying more in just a second. The second goal, in particular, eliminating health disparities, is getting increased attention again, especially since the department recently unveiled its greatest federal commitment to reduce disparities ever through a strategic action plan. So you'll be hearing more about that in just a second as well. Slide 11 stresses that of the many areas, the 28 topic areas and over 900 objectives that were set 10 years ago, that we could also put forward a subset of these that represent truly major public health concerns and are used and chosen because they can motivate action. We have good data for them to track progress, and they're highly relevant as in terms of public health topics. So you'll see 10 leading health indicators identified a decade ago in collaboration with the Institute of Medicine. So if you don't want to look at all 900 objectives and you want to focus in on a subset, here are the 10 that you can look at, the so-called leading health indicators, or LHIs. And then slide 12 shows the 28 focus areas that I've already alluded to. Some of these were continued from past versions of Healthy People. Others are new for Healthy People 2010, and we're going to be reviewing highlights of many of these in just a couple minutes. So people always ask now at times like this, have we made progress as a country? How do we measure progress? What do the outcomes mean? And on slide 13, we stress that we want to make some assessment based on objectives for which we have good, reliable data for which we've tracked progress over the years. Out of over 900 initial objectives, we have good, hard evidence to assess progress in some 3/4 of them, over 700. So that's what we're going to be reporting on today. And then on slide 14, you can see where we have met the targets made a decade ago, where we have made progress, and then where we have moved, unfortunately, away from the targets. Altogether, we have some 71% of objectives where we can measure outcomes where we have made progress. That is, we've either met the target or exceeded the target in some 23% or made progress in another 48%. So that's the big picture overview on these objectives. To make progress in some 71% of outcomes represents substantial progress according to this measure. But of course, we can always look down at the sub-analyses to decide where we need to do more work in the future. And this is the last slide I'm going to show before turning it over to Dr. Sondic. This is more detailed information about 28 focus areas. Some of them have many objectives, such as immunization and infectious diseases, as you can see here. Other areas have fewer objectives, like medical product safety. But we are tracking all of these and then trying to present these in a succinct way to you for general review and use.